Congratulations on the birth of your new baby. We want to take this time to review some important information to ensure you are well prepared to care for yourself and your new baby after your discharge home. If you had WellSpan prior to delivery, you should now be able to access your newborn's record on WellSpan. If you do not have a WellSpan account, consider enrolling. When you return home, it is very important to get rest. It is especially important to take the opportunity to rest when the baby is sleeping. When it comes to regular activity, moderation is the key during the first 6 weeks after you've had your baby. Your body will undergo many changes after delivery as it returns to your pre-pregnancy state. No heavy housework or exercise for 2 weeks. Check with your doctor for any restrictions on activities, especially if you had a cesarean delivery. Do not have sex or place anything in the vagina until your postpartum checkup at about 4 to 6 weeks postpartum to ensure you heal completely. It is important to care for your breast after delivery. One thing you can do is wear a well-fitting bra for support. This is important even when not breastfeeding. If you are not breastfeeding, in order to relieve discomfort and prevent engorgement, we suggest wearing a tight-fitting bra for support and using ice packs. If you are breastfeeding and experience sore and/or cracked nipples, to help them heal and help with discomfort, you can use a lanolin cream like Lansino, or place a few drops of breast milk on your nipples after a feeding and let them air dry. If your breasts become large, swollen, and/or sore, applying warm packs, massaging your breasts, and expressing a small amount of milk can help to promote your comfort. Occasionally, some women may get an infection of their breast tissue called mastitis. Signs of mastitis include breast pain, soreness, swelling, warmth or redness that may look like red streaks on the skin. Often this includes a fever and chills. Please report these symptoms to your doctor. Once you are home, if you have any questions or need help with breastfeeding or pumping, please contact WellSpan Breastfeeding Services or the lactation department at your delivery hospital. Our team of breastfeeding specialists can help you reach your breastfeeding goals. As mentioned, you should wait to have sex until after your postpartum checkup with your healthcare provider to ensure your body is well healed after the birth of your baby. While breastfeeding, you may not have a period, but you are still ovulating and may get pregnant. So be sure to use a reliable method of birth control to prevent pregnancy. There are many birth control options available, including barrier methods like condoms, hormonal methods like birth control pills, or long-acting reversible methods such as implants and IUDs. Talk with your provider to decide which method may work best for you. If you had a cesarean birth, to prevent infection, it is important to wash your hands before touching your incision and to gently clean the incision daily with mild soap. Then, rinse with water and pat dry. Call your healthcare provider if your incision is separating, if you develop a fever, or if you notice any bleeding, unusual odor, swelling, oozing, or redness around your incision. These could be signs of infection. Whether you have a vaginal delivery or a C-section, you will notice some vaginal bleeding after delivery. However, you should call your doctor if you are passing blood clots larger than an egg or are bleeding so much that you are soaking through a pad or more in an hour. Many new mothers experience the baby blues. Usually, the baby blues last for only a few weeks and disappear on their own. If your symptoms of the baby blues do not lessen after a few weeks or are so severe that they keep you from being able to do everyday tasks, you may be experiencing postpartum depression or anxiety, which could appear up to a year after having your baby. Call your OBGYN if you have any concerns related to postpartum depression. Our perinatal depression program is here to support you and find you the resources you need. You can email the program at wmcdowell@wellspan.org or call 717-851-4305. If you are experiencing thoughts of harm or feel you need help right away, please go to crisis intervention in your nearest emergency room or call the Lifeline at 1-800-273-8255. We also offer a virtual Adjusting to Motherhood support group via Zoom. To register for a session, please contact Childbirth and Family Education at childbirthedu@wellspan.org or call 717-851-2241. If you experience preeclampsia or high blood pressure during your pregnancy, please remember to take your blood pressure as instructed in the postpartum period. Make sure to let any other healthcare providers know you had high blood pressure during your pregnancy. Remember, preeclampsia can occur in the postpartum period too, so even if you did not experience any issues with your blood pressure during pregnancy, please report any warning signs like elevated BPs, headache unrelieved by Tylenol, upper abdominal pain, blurry vision, or spots before your eyes to your OB care provider. Please call your OBGYN for any of the following signs or symptoms: a temperature of 100.4 or above, severe pelvic or abdominal pain, blurred vision or spots before eyes, sudden severe headache, severe heartburn, burning and/or frequent passing of urine, redness, pain, swelling, or foul-smelling discharge of your laceration or incision, feeling down, depressed, or hopeless, vaginal bleeding that fills a pad within an hour, passing of blood clots larger than the size of an egg or many small clots. If you have a surgical incision, separation of the incision or any bleeding or drainage from it, a painful reddened area on your breasts. You may not have any of the symptoms listed here, but you may not feel quite right. If some extra rest doesn't help you feel better, check in with your OB care provider. You will receive a copy of a post-birth warning sign poster. We recommend placing this on the refrigerator or somewhere that is easily accessible at home to remind you of postpartum warning signs and when to call your healthcare provider. Now let's discuss important discharge information related to your infant. Always place your baby on their back to sleep. This reduces the risk of SIDS by 50%. In addition to being on their back to sleep, your infant should always sleep on a firm, flat sleep surface, such as in a crib or bassinet, close to but separate from you. Sharing a sleep surface is dangerous, and babies should never be placed on a couch to sleep. To prevent accidental suffocation and sudden infant death syndrome, avoid loose blankets and stuffed animals or toys with the infant when they sleep. Do not overbundle or overheat your baby. It increases the risk of SIDS. Babies only need one more layer of clothes than you wear to stay comfortable. It's also very important to keep your baby away from secondhand smoke because it increases the risk of sudden, unexpected infant death. WellSpan has tobacco cessation services which can be accessed. Safe sleep recommendations should be followed for both nighttime and naps until the baby's first birthday. Remember, never shake your baby. Shaking causes the baby's head to move violently back and forth, resulting in serious and sometimes fatal brain injury. Taking care of a newborn can be stressful. If you are feeling stressed, take a deep breath and count to 10. Place your infant somewhere safe, take a time out, and let the baby cry alone. Call someone for emotional support. And if your infant has been crying more than expected, call your infant's healthcare provider. There may be a medical reason why the baby is crying. You will be receiving a copy of Pennsylvania's Safe Haven Law with your discharge instructions. Please take a moment to review. Until age 2, always use a rear-facing car seat placed in the back seat of the car. Never leave the child unattended in the car under any circumstances. In order to keep your baby healthy and prevent infection, we suggest that you keep away from big crowds for the first few weeks after delivery and encourage everyone who visits your newborn to wash their hands before holding them. Do not give your baby any medications unless advised by your baby's doctor. Please call your baby's doctor if you notice any of the following warning signs: rectal temperature of 100.4 or greater, refusing to eat 2 feedings in a row, projectile vomiting, excessive crying, irritability, or sleepiness, difficulty breathing like wheezing or very fast breathing, watery stools with mucus, foul odor, or blood, increasingly yellow skin color, red or tender, unusual discharge around the umbilical cord, less than 4 wet diapers in 24 hours by 4 days old. If your baby has a circumcision, call your baby's doctor if you notice bleeding that soaks through the gauze in the first 24 hours after the circumcision, or if after 24 hours you see any bleeding from the circumcision. Make sure to refer to your discharge instructions for dates of the appointments for you and your baby. It is very important to keep all of the appointments you have scheduled for both you and your baby. My WellSpan portal messages may not be returned promptly. So if at any time you are concerned or have questions about your recovery or symptoms, please contact your OB/GYN office. Additionally, contact the pediatrician or baby's doctor immediately, day or night, if they are experiencing any of the warning signs discussed. Congratulations again on the birth of your baby. Thank you for the privilege of allowing us to care for you and your family.